We're talking about cardiovascular congenital disorders. And the three that we're going to be talking about is going to be coarctation of the aorta, Truncus Arteriosus, and then lastly we're going to talk about Tricuspid Atresia. So starting off here with coarctation of the aorta, essentially what's happening here is that the aorta is going to have a narrowing, basically that's right after the patent ductus, right before the patent ductus arteriosus, but right after the arch of the aorta. So in other words, if I'll erase this and kind of show it right here. This is a diagram of the heart like this, okay? And so we have the right atrium, left atrium, right ventricle, left ventricle, and down here we're going to have the pulmonary trunk and the aorta. So you have pretty quickly coming off of the aorta, the arch of the aorta, which is going to have these blood vessels coming off this way. Okay, then you're going to have this patent ductus arteriosus, or this ductus arteriosus, which connects the pulmonary circulation with the rest of the aorta here, and the coarctation of the aorta is going to happen right here. Okay, so it's going to have this extreme stenosis, narrowing right there. See that? And so this is going to cause a number of things. Basically, you're going to find that it's often associated with patent ductus arteriosus, which was something we talked about earlier, where this stays open. Okay, so it's highly associated with conditions where this is going to stay open in the baby, and it's going to lead to lower extremity cyanosis. Let me kind of explain why. So the deoxygenated blood comes into the right atrium, down into the right ventricle, and then it's going to go down here and go into the lungs, okay? And this is where it's going to get oxygenated. Then it's going to come down in here, the oxygenated blood is going to come into the left atrium, go down into the left ventricle, and then it's going to come down here, and these branches here on the arch of the aorta go up into your arms and your head, okay? So this goes to your head and arms. Head, arms. So there's a stenosis here, coarctation of the aorta. So most of the blood is going to go to your head and arms, but not very much of the blood is going to go to your lower extremities, which is where it goes after that. Okay, so that's why we have lower extremity cyanosis. Also, a lot of times it's associated with, I guess, Turner syndrome as well. So there's a infantile form and there's an adult form. So the adult form is basically one without this patent ductus arteriosus here. So this is kind of what happens. So we're getting rid of that. Now it's just, turned into that ligament or whatever it is. And so what happens in the adult form is that, of course, you're going to get hypertension of the upper extremity. So you check your blood pressure on your arm, it's going to be super high, but if you were to check it on your foot, it'd be really low. So hypertension of the upper extremities with hypotension of the lower extremities. You're also going to see that a lot of times it's going to be associated with a bicuspid aortic valve. So you look at this aortic valve, you're going to see this valve is going to be bicuspid. You're going to see something called collateral circulation. So when your body is being deprived of oxygen in different places, it starts to create, it sends little signals, VEGF signals, vascular endothelial growth factor, and then that grows more blood vessels. And so the body's going to try to grow blood vessels to essentially bypass this stenosis here and get to the rest of your body and lower extremities and everything. And so one of the things that it does is it uses the collateral circulation and goes across the intercostal arteries. Okay, so you have these intercostal arteries going across your ribs here, and it's going to send a lot of blood and a lot of blood vessels into those, and those are going to get so big and engorged that if you look on an X-ray, this is like somebody's ribs, it'll actually like kind of wear away at some of the bone almost. You'll kind of see this like notching here where the ribs have this, notched appearance. You'll see that on X-ray because of this, collateral circulation that's occurring with that. And if you were to follow the blood here, blood's coming in, great, blood's going out, then it's coming down here and, going this way and then that way, but not necessarily the way that it needs to go or should be going down to the lower extremity. So that's the first one there. That's the Truncus Arteriosus. Now we're going to move on, that's the coarctation of the aorta. Now we're going to move on to the Truncus Arteriosus, which is where, normally you've got a blood vessel coming off here, and the aorta coming off here, and the pulmonary trunk coming off here. But in this case, they failed to divide properly. And so what you have is one giant Truncus Arteriosus. It's like a pulmonary trunk plus your artery combined together, and the blue blood, the deoxygenated blood, and the oxygenated blood from the right ventricle and left ventricle just gets sloshed together into one giant tube, making slightly oxygenated, slightly deoxygenated blood. And then later on, this half and half blood gets sent to the lungs and to the body. Like then it does down here what it should have done right there. And so you can imagine what's going to happen to this. It's going to have, cyanosis because it's a waste of energy. It's a waste of blood flow. These tracts need to be separate so that the deoxygenated blood can go to the lungs and the oxygenated blood can go to the body, not it mixed together and a little bit of both go to both places. It wastes energy, wastes time. Okay, last condition here is the Tricuspid Atresia. Hopefully you can see that over there. So in the case of Tricuspid Atresia, what's going on is the tricuspid valve does not develop. Okay, the tricuspid valve, where is that valve? That valve is right here. This one does not develop. So that means that when blood comes from the body into the right atrium, it doesn't go down into the right ventricle because there's no way to go down there. Instead, it comes across this atrial septal defect, comes over and forms a right to left shunt. So it goes from the body over here to the right ventricle, and then from the right ventricle down to the left ventricle, and then from the left ventricle, down into the body. But you wonder, how could the baby live? Well, when the baby's inside the mother before the prostaglandin E shuts off, there's a connection between these two, so it could still go over into the lungs across the ductus arteriosus. But after they're born, that shuts off, and so this baby's going to have a really hard time. But because there's no blood going down here, you're going to get a hyperplasia is where something grows a lot, and hypoplasia is where something doesn't grow very much. Because this has never been used with any blood, your right ventricle becomes very hypoplastic. So you get a hypoplastic right ventricle. And again, it's associated with the atrial septal defect and a right to left shunt and early cyanosis, as would be expected.